Hello, Janaya.
Hello.
My name is Lisa. I'm going to be your nurse today, and I was given permission by both your parents. Janaya is a minor, and I have permission from both mother and father. So first, I'm going to close the curtain, giving my patient privacy, perform hand hygiene. May I please have your band? What is your first and last name?
Janaya Smith.
And what is your date of birth?
12/3/09.
Do you know where you are?
Yes, I'm at the doctor's office.
Wonderful. And do you know who the President of the United States is?
Yes, Donald J. Trump.
Patient is alert and oriented ×4. I'm going to start by assessing your pain. So you're having pain.
Yes, on my knee.
On a scale of 1 to 10, what is your pain?
5.
Okay. Now, what brings your pain on
When I dance.
when you dance? And what's the location of your pain?
My knee.
Your left knee.
Yeah.
Okay. And how long does the pain last for?
A few seconds.
Okay. And what is the characteristics of your pain? How does it feel?
It's sharp.
Okay. And what aggravates your pain?
When I put pressure on it.
Okay. And what do you do to relieve your pain?
Painkillers.
You use painkillers.
Mm-hmm.
Okay. And how often do you take these painkillers? Is it just once for the pain, or is it a consistent thing?
Once for the pain.
Okay. Now we'll address that in the assessment. Okay. First, I'm going to start by assessing your hair and your scalp. I'm going to check for any edema, bruising, scars, alopecia, or infestation. There is no lumps, no bruises, no edema, and no infestation. Hair is clean, scalp is moist. While I'm here, I'm going to assess her ears. Okay, you want to pull up and back to view the tympanic membrane, which it is gray and shiny. I'm also going to check the patient's nasal cavities. Can you place your right hand on your nostril? Breathe. Anyone. Other side. Can you rest your head back? Let me check your nasal cavities. We're checking for any deviation or any polyps. And nasal area is clear. Can you open for me? Stick your tongue out. Okay, mouth is moist and wet. Mucous membrane is pink. Lift your tongue. Can you say ah? Okay. Can you swallow? Okay, wonderful. We're going to start by checking out some of the cranial nerves. We're going to check the olfactory nerve first. I'm going to place this cotton under her nose. She's going to tell me what you smell.
Me.
Yes. Next, I'm going to check her eyes. The test was already done. The Snellen test was already done. Our patient does have 20/20 vision, as well as her vital signs were done prior to the assessment. All vital signs are within normal limits. We're first going to check for Perla. Open your eyes, please. Pupils are round and reactive to light. We're also going to check for patient sclera. There's no sign of cyanosis. Pink, healthy, and moist. We'll also check the field of gaze. Can you follow the pen for me, please? Patient's field of gaze, normal. That was cranial nerves 3, 4, and 6. 2, 4, 6. We're going to check cranial nerve number 3. I'm going to perform the whisper as well as the Romberg. Apple pie 2213.
Apple pie 2213.
George Bush. Hillary Clinton.
George Bush, Hillary Clinton.
Patient's hearing is equal on both sides. Now, excuse me. We're going to check your balance. Please stand. Hold your hands out for me. Close your eyes. No swaying. All right, put your hands down. Can you walk forward from me? I'm going to assess your gait. Gait is even. Patient is not favoring right or left knee. Please turn. Did that hurt? Okay, please have a seat on the bed. Thank you. All right, while you're sitting there, can you please place your hands on your knees and turn them back and forth? Now take your right leg and rub your down shin. Thank you. And now your left. Thank you. Now I'm also going to check for the trachea as well as the thyroid, which is thyroid is unpalpable, palpable, and the trachea is even, no deviation. I'm going to check for JVD, no jugular dysfunction detected. I'm going to also now check her lymph nodes. We're going to check the pre-auricular, post-auricular, ocular, tonsillar, superfacial, the supramandibular, submandibular, and the submental, as well as the supraclavicular. All lymph nodes are not palpable. I'm also going to check the carotid artery, right and left. I'm going to auscultate first, one side at a time. No bruit detected. Now I'm going to palpate. It is even. I'm going to check her brachial pulse bilaterally. Now the radial. Pulse is even. While I'm at her fingers, I'm going to check her capillary refills. Turn to the side this way so you can see the whole body. Capillary refills. Refill after in less than 3 seconds. I'm going to check her tendons. Brachial, tricuspid, and radial tendons all responsive. Patient is a little tired. Okay, look at me. I need you to stick your tongue out for me. Lift your tongue. Can you say 99?
99.
Cranial nerves 9 and 10 are intact. Can you smile for me? Wonderful. Can you blink your eyes? Okay, now we're going to check your trigeminal nerve. I want you to close your eyes and tell me when you feel this.
I feel it. I feel it. I feel it.
Thank you. Now I need you to shrug your shoulders. Again. Trigeminal nerve 11 and 12 all working fine. At this point, I am now going to ask the patient to turn this way. We're going to check. Sit straight up. We're going to check the chest cavity. We want to check for symmetry and to make sure that as she breathes that the chest expands and deflates evenly. There is symmetry along the chest cavities. There's no scarring, no scarring, no stretch marks. Okay. So first we're going to check for her breathing. Inhale. You know, being to put this in my ears. Again, breathe in. Again. 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 All right, can you turn around for me, please? Turn that way, good. Breathe in. Okay. Inhale. Inhale. Again. 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 And one more here, please. Turn around. No abnormal findings. Lung sounds present in all cavities. Now we're going to auscultate. Sit straight up, please. Sorry. Now we're going to auscultate the chest cavity for heart sounds. We're going to start in the upper right upon the second intercostal space, and then we'll move to the upper left along the second intercostal space, and then down. So first we check the aortic, the pulmonic, ERBs along the third, the tricuspid along the fourth, and then the mitral valve along the fifth intercostal space. S1 and S2, excuse me, are strong, no visible findings, no bruits. After this, we are going to, I already auscultated for breath sounds, I've done that. We're going to check the lower extremities. See what I mean? Please, put your legs down. Okay, first, I'm going to check your tendons for Keep going. Ready? Lower extremity tendons are responsive. We're going to check the pulse. Pulse is even and strong. I'm going to check the capillary refills. All capillary refills are less than 3 seconds. Excuse me. Now we are going to check the, what have I done? We're going to check the strength of her joints. Can you hold your hands up, please? I push my hand up, put my hand down, kick your feet out, put your feet in. And at this point, I will be checking her abdominal cavity. Can you lay down, please? When was the last time you went to the bathroom?
A couple hours ago.
Okay. Have you had anything to eat or drink since then?
No.
Do you need to use the restroom?
Nope.
Okay. First, you want to inspect the abdomen. Skin is even. No scars, no protrusion. Stomach is flat and muscular. After that, I'm going to auscultate, check for bowel sounds. There should be 30 bowel sounds every 5 minutes or so. We're starting the lower right quadrant. normal bowel sounds. Now we're going to palpate. No abnormal findings. Dull. Please. No abnormal abdominal findings. Please sit up. Okay. When you were moving your knee, did you have any tenderness?
Oh.
Okay. I will inform the doctor when he comes in, and it'll be on your notes. Please have a seat. Now I'm going to hand the patient off to the doctor and write my notes.